Hi, I'm Pippa, otherwise known as Dr. Pippa K, and today's video will be something that the Medscope wanted me to talk about actually. Today I'll be talking about what I thought dentistry was going to be like versus the reality of what it is to be a dentist. My expectations versus the reality of it all. I will start with the first point. The first thing I was looking forward to was treating patients and people. I thought that this would be a very rewarding experience to have daily. And then you could argue actually that this is something you could have with a lot of healthcare professional careers, such as nursing, medicine, anything like osteopathy, healthcare physicians. There's so many. That aside, the point is, I thought it would be very rewarding. The second thing that I thought that it would be was I thought it would be very challenging. So I was looking forward to kind of having something new every day, something different to resolve, kind of like having a new puzzle, and you put the pieces together, and you put the picture together, and you have to solve the problem. So that's what I really wanted, because I thought, I don't really like having a day-to-day where everything's pretty much the same. Like I don't really enjoy that. I like having something new. So I was expecting that there would be that kind of challenge coming in every day. Then I thought also that it would involve a lot of science, and that was very science related, biology related, to do with the human body, and that's what I kind of have geared myself up to do for a lot of the career choices that I have made. So that was something else. See, that's number 3. And then number 4 is that I thought it would have a good wage, like a good salary for what I was doing. And that was important as well, because it is important to have a good life balance, and part of that is the salary that you would get. So these were my expectations going into the career. Now that I have achieved my degree and I have 1 year of foundation training, which of course is not representative of a working career completely of a dentist, as I haven't had enough of those years, and another year in hospital, which is still working as a dentist but not a general dentist, not a general dental practitioner, but still dentist. From my experience that I have had, I will tell you the differences, because also I have been working as a dentist during the degree that I participated in, and although of course I wasn't qualified until the end of it, I was practicing treatment under the guide of being a dental student, for the years that I was at King's. The reality of it and how these expectations differed or didn't differ compared to what I thought it was going to be. I'm going to go backwards, I think, backwards through my points. So the final point that I did talk about was wage. So of course the salary that you get is higher than average, and it is supposedly proportional to the degree that you have undertaken, but actually I don't know if I think it is proportional, but it is higher than average. It isn't an easy job, and it is, I think, a lot more intense than I had maybe anticipated. Not to say that it is not a fun or a good job, it's just a bit more intense than I may have thought earlier on. Moving backwards, I spoke a lot about how I thought it was very science orientated, very human sciences, biology, human body, but after coming out the other side a bit, I found out actually it is a multitude of disciplines and covers a lot of factors, and in itself it feels like it's multiple degrees in one, because there are a very vast amount of specialties and things that are covered. So I made a list. Something like physics is a very predominant aspect, and in that is material sciences as well. These things are very, very important if you want to have that kind of technical aspect nailed down. Then we have chemistry and maths, and these are also very important. Some people might say to you then that we learn them and that they're not important, but ultimately understanding, going into understanding the materials and why the treatment that we do works and how teeth move, and those things really require an understanding in the maths and chemistry and the physics of it all. If you don't understand those things, then you're not going to be able to problem solve why things go wrong. Then we go on to kind of the more person side of the work, which is business and communications, professionalism, psychology, and even philosophy, and professionalism. And these are all aspects that are all, there are science. There are some of these things are sciences within their own right, but they're not in the traditional sense, like a biology or physics kind of thing. And so all of these things are very equally as important, if not the most important parts of becoming a dentist. Is very important to recognise and observe and also understand a lot of these things, and we are regularly looking into and practicing and training into communication, psychology, and philosophy and business. Like all of these things are very, very important overall in the treatment that we give and every day. So the second thing that I said was that it looks very challenging, and so there's something new every day. And there's two sides of that. There's on the one side there is like there's that whole phrase of lifelong learning, and in that it is definitely like that, because you are continually, you would hope to be continually learning and upping the information that you have and the knowledge that you have every day. Every day you are learning and trying to add to your repertoire of knowledge, and trying to improve what you do know every day, and kind of also paint over and always more fully trying to understand even the basics every single day, every week, every month, every year. We have that, and it is challenging because you will always have new things that come in, and they challenge you to kind of think outside the box, or try and resolve something, and you do have that every single day, and that's what I really, really enjoy. There are some aspects of it which can seem repetitive sometimes, perhaps specific clinics, or if you see a particular problem all the time, then you know exactly how to deal with that. And especially if you're more experienced as a dentist, you will have seen certain things so many times, thousands of times, that by that point you will expect it, and you'll see it. You'll see the dots come together, and you'll be like, okay, right, it's that, I know that, and to maybe that's not challenging because you know it, but actually that is part of the fun in the fact that you now have that enough experience to recognise that is what it is. I think that's really cool as well, to be able to have enough experience to be able to recognise things like that and then put that into practice. And I look forward to having these kind of things over the years. Then the final thing that I thought the reason I wanted to do backwards is because the final thing I wanted to end on was the fact that treating patients, I thought, that's going to be really rewarding, it's going to be really fun, and actually I found out that it is really, really rewarding. It is a thankless job, but I mean that to say it's just like you don't do it for their thanks, but you do it because you want to try and get people to be in a better position than they were when they came in to see you. And it's like your job to try and do your best to make sure that happens. So if you can fix their problem or help them out, then that is the best thing ever. And that's what you're kind of aiming for. And if you can't do that, then palliative or something helpful, at least towards their symptoms, that is the second kind of plan. So I have found that there are days where you may not be able to feel that reward, or you might not be able to resolve the exact problem that somebody has, but you know, in the job that we do have, that you can always help in some way to move someone to at least someone else who will be able to help them, and so in that perspective, it actually has really fulfilled that, and so I do really enjoy it. So to recap, the 1, 2, 3, 4 points that I had were firstly, the salary is somewhat what I expected, but it really varies depending on what kind of career you're following at the time, because there's different kind of careers that you can have. Then I was talking about being very biology related, and actually it turns out to be so many different kinds of disciplines within one, which is very important to remember, because that makes it multifaceted, really. And then the third thing was that it looked very challenging, and that was going to be really fun, and it is actually very challenging. There's so many, every day there's something new to learn, something new to resolve and put together, but mind you, it can be very stressful and very time intensive, and also there's a lot of responsibility that I didn't realise beforehand. You can see it, but unless you experience it, you don't really understand how much responsibility lies on your shoulders, because a lot. So that was different, and then treating patients being rewarding, yep, completely ticked that box, and it is that every single day, which is absolutely great. So I want to say thank you to Medscope for coming up with the video idea and asking me to do this. So I hope that this was helpful and a good insight into at least my experience in it, my personal experience. So I can't talk on behalf of dentistry or people, like I would never. It's just a personal view of it. So yeah, watch out for my next video. Peace out.